Cover test and Prism cover test. Cover test is one of the important part of a comprehensive eye examination. This test is used to evaluate and quantify ocular deviations that may be present, which are called tropia and phoria. Tropia is a physical misalignment in one or both eyes that can also be called strabismus. On the other hand, phoria is a deviation that may only be present when the eyes are not looking at the same object. Prism cover test is a diagnostic tool used to measure and record the degree of misalignment of the eyes, also known as the angle of deviation. It provides a quantitative assessment of the deviation by using prisms to measure the amount of correction needed to align the eyes. Material need as below: opaque or translucent occluder, horizontal and vertical prism bar or loose prism, near accommodation target, distance target. Cover test procedure can divide to two parts: the unilateral or cover-uncover test, the alternating cover test. Both parts of the evaluation are performed at far and at near. The cover-uncover test is done first to determine if a patient has either a phoria or tropia. The alternating cover test is used to measure the magnitude and direction of a deviation. The unilateral cover test performed first, with patient habitual correction. Instruct the patient to look at the target and keep it clear. The target should be 1 or 2 lines above the patient's best corrected VA. The near target should be approximately 40 cm away from the patient. Cover patient one eye with the occluder, look at the opposite eye to see if it moves to pick up fixation. This process of covering and uncovering the same eye is repeated 2 to 3 times to verify observation. Repeat on the left. The same procedure for near cover test. Results: if no movement was observed, there is no manifest tropia. If movement detect, uncovered eye moves to fixate on target, it signifies a tropia. Alternate cover test. Cover one eye with occluder, hold at least few seconds to allow the other eye to pick up fixation. Switch quickly the occluder to second eye, observe the first eye movement. Repeat alternating back and forth few times to observing movement. The same procedure for near cover test. Result: if no movement detected, there is no phoria. If movement detected, phoria detected. Measure the magnitude and direction of deviation. Distance cover test. Direct patient to focus 6/9 distance chart. Start with unilateral cover test. Cover patient one eye with occluder, look at the opposite eye to see if the eye pick up fixation. Repeat 2 to 3 times to verify. Then alternate cover one eye with occluder, hold at least few seconds to allow other eye to pick up fixation. Switch quickly, cover the other eye. Repeat few time. Repeat on the other eye. Eye movement interpretation during cover test. When cover one eye, the uncover eye move outward, esotropia. When cover one eye, the uncover eye move inward, exotropia. When cover one eye, the uncover eye move downward, hypertropia. When cover one eye, the uncover eye move upward, hypertropia. 1. Occlude the deviating eye and put a prism of approximate strength over the deviating eye or non-fixating eye, with its apex towards the direction of the deviation. 2. Remove the occluder and observe the movement of the eye. Fine-tune the prism strength until no movement is seen on uncovering the eye. 3. Check alignment under the prism using the corneal light reflex, which should be in the same position on each eye when they are aligned. 1. Occlude patient one eye and put a prism of approximate strength over the deviating eye or non-fixating eye. Cover-uncover. Observe the movement of the eye. Fine-tune the prism strength until no movement is seen on uncovering the eye. Check alignment under the prism using the corneal light reflex. The cover test and prism cover test are the easier and faster way for us to detect any misalignment of the eye, either tropia or phoria, present on a patient and identifies the direction of deviation. The prism cover test quantifies the deviation magnitude in prism diopters. This test vital for diagnosing and managing strabismus and binocular vision disorders, guiding treatment decisions such as prescribing glasses or vision therapy. Accurate results should be interpreted considering the patient age, symptoms and refractive correction status.